went from the bonnet, found face down on the floor.
2, 3.
Pediatric trauma.
It's a stabbing quadrant.
25 feet from a ladder onto his back.
He's really unwell, and I think anaesthetics need to see him before he goes to theatre.
Daphne? Daphne?
How is everybody then? Chilling?
King's A&E, how may I help?
King's College Hospital, London.
I got stabbed.
I know, it's annoying.
My head.
One of the busiest A&E departments in the world.
I want top to toe, head, chest, abdomen.
A place where love, life, and loss
Don't bloody die. I love you too much for you to die.
unfold every single day. All the patients you're about to see were treated in just one 24-hour period.
A&E is always like a traffic jam. Can we get a trolley?
You've got to realise that there's awful things that can happen to you.
I'm so sorry.
Life is unpredictable, so it's important that your nearest and dearest know that you love them. You have to tell them that you love them.
You must get better and come back to me. I don't want to lose you.
Because there may come a time when you're not around to tell them.
A march and freeze. Look, there's an ambulance. Nino? Ambulance. Ambulance.
Right, I've just got to make an appointment, darling, for Monday, OK? Daddy's going to be here in a minute, all right? Daddy. Yeah, he's coming in a minute, OK? Here you are, you play with him. Bertie, I'm here. I'm just doing an appointment, OK? I'll be back in a second, all right? Yeah, I want to refer this patient who was referred to the medical team yesterday and is presented today.
Ling is one of the doctors on shift in A&E today.
I wouldn't say I was a perfect A&E doctor, but certainly my personality suits A&E because I get bored quite easily. I like to mix it up all the time, move on from case to case. I've seen the patient, I've done the bloods, I'm making as a new referral who needs to come in. I would say that I'm quite competitive. I think that's also the nature of being a doctor. You're always fighting to get your place at university, trying to pass your exams. There's no abdominal pain or tenderness. Completely soft, bowel sounds are active, no fevers, no weight loss, no family history, just completely well. ADU. Certainly on the sports field, I can be very competitive as well. I've been playing touch rugby, shouting at team members and also probably at myself if I wasn't performing as well as I wanted to.
Go ahead. Oh, right. Hello, sir. Please follow me. Yeah, this is yours.
I do see it a lot in A&E, men who are injured and being with their girlfriends and their mums. I think as women, it's a natural sort of part of our instinct to want to protect our men.
She's your mom?
It is, yeah.
Okay, yeah.
Come to the rescue, always.
Yeah. Is he the only son?
Only son, yes, I have a daughter.
Oh, you have a daughter as well,
She's
okay.
a bit more sensible.
All right.
Ed. Hello, Team Resus. Okie dokie. Yep. Lovely. Thank you.
Adult trauma 4 minutes, that's adult trauma 4 minutes.
A 19-year-old man is being rushed to King's from a rugby match in Kent.
When we get the phone call saying that someone's been involved in an injury On the rugby pitch, the instant thought is it a neck injury? It's completely life-changing. The risk always is that there could be nerve involvement as well, and the person may never walk again.
College student Chris is being taken straight to Resus. His mum and dad have followed him to King's.
Parents are outside.
Fantastic.
You got hold of?
Yeah. Yeah.
On 3. 1, 2, 3.
Good evening, sir. How are you doing? My name's Lucy. I'm one of the nurses. I'm just going to start doing things like blood pressure and tracing of your heart and things like that. I'm going to attack you with stickers, OK? So just bear with me. Cool.
Had 2922, 19-year-old male playing rugby, went into a ruck, took full force on his head. Immediate pain on central below the atlas. He has a rest rate of 18, SATs of 98. That right leg, it just says it feels numb.
If we also hear that somebody has any change in the sensational strength of their arms and legs, then we're very worried that there's been a significant injury to the neck.
Hello there, I'm Ling, I'm one of the doctors. Nice to meet you. How are you doing? Not feeling very comfortable, I'm sure.
No, my lower back is...
Your lower back's killing you, is it? I'm just going to have a little look at your neck and your lungs and make sure everything's OK. All right, so a little feel here. Do you have any pain when I feel in the front here?
Nice deep breaths in and out for me. Take nice deep breaths. And again. No obvious external evidence of trauma.
No pain in the legs, no, it's just right side numb.
Ling, do you want to give the morphine while I draw up the cyclosine?
Can you give some painkillers in this arm, all right?
Everything in life comes with risks. People have accidents every day, and he wouldn't be living his life if he wasn't doing what he wanted to do. But when I arrived at the rugby field, I've never seen him like that before. He was inconsolable. He was in so much pain.
Ready, brace, turn.
The guys at the rugby club said that the crew were taking him to King's. And I said, oh, well, can you just tell them to hold on a minute, because I don't know the way and I will follow them. He said, oh, no, they will blue light him there. You won't be able to follow. So it wasn't until I was on my way there that I started to worry that it could be more serious.
Oh, are we ready? Marvellous.
Doctors are worried about Chris's spinal pain and the loss of feeling in his right leg. He needs an urgent CT scan to reveal the extent of his injuries.
All right, see you in a bit.
Matt, come on, you got a good voice.
What for?
Turn on for this man to come to minors.
Romanovsky.
Romanovsky.
Come on, you can do it.
You can do it. Speak clearly.
Patient announcement. If there is a gentleman called Romanovsky, can he please come to minors? Thank you.
Romanovsky, you've done it well good, thanks.
Well good.
You did it well good, Matt.
We're on the bus, ready? Tickets, please, Daddy, tickets. Beep, beep.
There you go.
Sit up then, we've got to ride our bus.
Yep. Layla driving. Are you driving? Is that how bus drivers drive, are they?
Beep, beep.
What buses have you been getting on?
Round the corner.
So where is he then?
I don't know. Do you want to go with me to have a look outside for him?
Go on.
Do you?
Yeah. He'll probably be the Russian-looking guy.
But
Let's go. Let's go.
Come on. We're going to find him. Matt's going to hunt him.
The majors won't free, please.
Wrong line. Shall we meet around
this way?
That way.
Mamonowski!
Yeah, do you know what he looks like?
No. He's nowhere to be seen. Ramonowski. That's a very good pronunciation, isn't it?
You sound like Russian. I thought Biaskowski.
No, Shalskowski, no.
This is staff nurse announcement. Amanda, can you come back to my nose? The patient you're looking for is back in my nose.
Amanda!
You find it?
No, you said...
Oh, Matt, you've got it. Thanks a lot, darling.
All right, then.
19-year-old Chris has suffered suspected neck and spinal injuries while playing rugby. He needs an urgent scan so doctors can fully assess his injuries.
When Chris was born, it was just the best moment of my life. It was just great having a baby boy. Chris and I have always been really close, right from the beginning. No matter how big he is or how old he is, he'll still be my boy. He's a good son. He's very protective. Couldn't want for more, really.
Okay, ready, brace.
He's definitely stepped up since his dad and I separated.
Chris's girlfriend Becky has joined his mum and dad at his bedside.
Yeah, you can just go in. He needs to stay absolutely as still as possible, all right? So just encourage yeses and nos and not nodding and shaking. It's so hard to do, you don't even realise how hard it is, but...
They said, what's wrong yet?
They said there's a build-up of fluid in my neck or something. And a bone at the bottom of my spine doesn't look right.
Oh.
Did he say something about the report? Because the doctor had a
There's a
preliminary...
build-up of fluid on his neck and there's a bone at the bottom of his spine they're not quite sure about.
Yeah, so it's not immediately obvious from what he's seen, so he needs to have a chat with other people. Take it from there, all right?
Where's Becky?
She's there. You have to stand here because I don't need to see you.
Come here.
Oh.
Come here.
How did the game go in otherwise?
It was all right. They were quite big.
I met Chris at work in Sports Direct while I was on the tills and he was working in the shoe department. I thought that he was a really nice guy, good looking. We were friends at first, and obviously it went on from there. And I got to know him really well and got really close to him. He cares about everyone. He's a very nice person in that sense.
Where's your hand? On a squeeze someone's hand?
I think sport is definitely one in common because I think we both feel the need to be active and do things. And I think with him, I think if he didn't do it for a prolonged period of time, I think he'd find it quite hard.
Anything you want me to do for you?
Stay there for me.
Okay. Not going anywhere. Top again.
Charge nurse King's College Access and Emergency Department. Can I help? Yeah.
Second call for process to be I don't make for 5 minutes. I don't make for 5 minutes.
A man in his 30s has suffered head injuries after falling down the stairs at a tube station.
Good evening. You cannot go through a Saturday night in an A&E department and not have someone who's pissed. You know, that is a guarantee.
1, 2, 3.
You get a lot of public transport-related drinking injuries. They're the serious ones.
Fell down approximately 19 concrete steps after drinking an unknown amount of alcohol. He's got a 4-inch by 1-inch laceration to his forehead. Cranium is visible. Got current GCS as 14, losing one for voice because he can't remember where he was.
He's sent himself a scan.
He was watching rugby. He can't remember where he lived.
So he fell down 19 steps?
Concrete steps at Tube Station.
OK.
Literally from top to bottom.
OK. Hello, mate.
Hello.
My name's Matt.
Hi, Matt.
What happened?
I've been drinking.
How much have you been drinking?
Too much.
Yes, correct answer. The impact of alcohol on the health system is huge. Without alcohol, we would have a lot less attendances, definitely. What day is it?
Tuesday, I think.
OK, what year is it?
That's a big question, yes, I don't know.
OK. When's your birthday?
Tuesday.
Open your eyes.
Hello.
OK. When was the last time you had anything to eat or drink?
Tuesday.
OK. There's probably 3 types of drunks, I reckon, thinking about it. You've got the really, really angry drunk who are just really fighty and aggressive. OK, so you're going to get a sharp scratch in right arm, OK?
OK, thank you.
No one's ever thanked me for sticking a needle in them before. And then you've probably got the silent drunks, like, you know, the totally off their faces, lying in a heap and vomiting their hair drunks. Is your wife in London?
She is, yeah.
Would you like us to call her?
I think it's best you do.
OK, all right.
She'll kill her. You know what?
Short scratch.
Out, yeah.
I think I like the happy, apologetic drunks. They're quite endearing and, you know, they're not much trouble. Sharp scratch.
Yeah. You guys are nice. I love you.
I've had patients try to strangle me. I've had patients spit in my face. You'd think I would remember a patient telling me they'd love me, but no, I don't remember. Any pain in your tummy at all?
No.
OK, what about your legs?
No.
This is Ling, she's one of the other doctors.
Hello.
Hi there, nice to meet you.
Hello.
So all this blood is from the head?
Yeah.
Okay.
Were you watching some sport today?
Rugby.
The rugby?
We didn't do too well.
Oh, really? What was the score?
I have no idea.
Oh, OK.
I'm a bit pissed.
Oh, you're a bit drunk. Who won the Wales-Scotland match?
I think Wales did.
Well, oh, great.
Just guessing there.
I could be guessing.
OK, fine.
Banter positive.
Yeah. And do you have pain anywhere?
No.
Not even in your head?
No.
I think that if I woke up with a huge scar on my head, that would be a pretty good reminder never to drink that much ever again in my life, ever. If you fall down a flight of concrete stairs, you know, it is a lucky escape if all you've got is a cut.
A bit of a fancy, aren't I?
We don't tend to see them back again. I think, you know, that's a lesson learned.
After having a clear brain scan, the cut across the man's head can be stitched up.
Stand up for me a second, just take a seat in that wheelchair. And we're gonna go and basically you can sleep it off and feel a bit rubbish in the morning. And that is what's gonna happen next. You're gonna wake up with a pounding headache.
You're such a nice person.
Well, I might as well get the unpleasant news out of the way first. No problem. Hopefully next time you'll be a bit more careful negotiating the stairs. Hopefully. Well, time will tell. Time will tell.
Right? You all right? Better than you were?
Yeah, I'm still dizzy, man.
Still dizzy.
I'll tell you what, my back, my lower back hurts.
Is it? I'll put it on. It might be just the way you're laying, actually.
Don't touch him. Don't touch him.
No,
Don't touch him.
Oh. Might be just about how he's laying on the bed.
No, it's not.
It's not.
Isn't it?
It's not.
Right. I've had a chat with the X-ray doctor. Your neck is fine. That's all good on the CT. However, the bones in the lumbar spine, the lower spine, that one that we were a bit questionable about. I'm going to go take you back round and get another CT scan of just that limited area.
Okay.
Yeah, you should
Okay, because it's still there.
Yeah.
All right, but we're going to find out. It's good news and it's all bad news.
I've never really been one to try and second guess anything before I know all the facts.
Do you feel numbness in your right
leg?
Right leg, yeah? Okay. Are you able to wiggle your toes? This one, press it, press my finger, press my finger, press my finger. Hard.
Push.
Hard.
Didn't bear thinking about that it would be serious enough that he wouldn't walk again.
Here, up, hard you can. That's fine. Here as well. This side.
At that point, while you're waiting for results, you have to stay optimistic that it will turn out okay.
Can I have a customer care officer 2 majors, please? Thank you.
No, you can't.
I send a text to you.
Yeah, do it quietly then.
Text Charlie. Hello, Charlie. I'm waiting in hospital right now, and I'm wondering if you'll ever get out of it, because it's horrific for me. I hate it. I hate it.
Keep rotating your feet.
Where's Becky?
Huh?
Is Becky still there?
Yeah, Becky's still
Where is she?
Becky's very much at the centre of his world.
Very much so, yes. It's been great for Chris to have Becky in his life, but I see Chris less than I would have done ordinarily.
Try and get some sleep. Try and get a bit of sleep. At least when you sleep,
Bring a housekeeper to minors, please. The housekeeper to minors, thank you.
Sorry, down a bit.
You're not going to be happy, are you? We've been together for about 1.5 years now. We can talk about anything, you know. I can't be embarrassed around him at all, because I just know we'll just laugh at each other and it doesn't matter. And I think that's what, in a way, makes it special for me, is that I don't feel the need to be self-conscious around him.
Chris is being taken for a second CT scan to discover whether the lack of feeling in his leg could be permanent.
See you in a bit, yeah? He's a big part of my life now, and I don't want that to ever go. And obviously, I was just worried that, you know, what if this changes his life so drastically, you know, that it's not the same anymore.
After the scan, Chris will be moved to a specialist ward to wait for his results.
You look like a little gerbil. You look like food in your cheeks. Can we swap sides, please? I can't look at your face that way. Oh, you can face the other way. Looks like a long nose.
Oh, Squidward's nose.
Yeah.
Oh.
Yeah, let me take a picture.
SpongeBob SquarePants. Oh, let's go home, I'm good.
No.
I feel better already. That hurt.
Exactly why we're not going. I wore my onesie all day yesterday, and I went to the shops in my onesie. Actually, not all day yesterday because I was at work. You were at work. But when I got home from work, that would have been weird. I put my onesie on, then I put my two rab jackets on at the top. I wore my trainers and went to the shops. And I thought, do I look cool? I've been an A&E doctor for about 6 years now. Where have the notes gone? I think I was actually always put off doing medicine to begin with because my father's a GP and he always used to work long hours. I'm like, I'm never going to do that.
Let's go. What do you think of that girl with the...
16.
Yeah.
Yeah, she's fine. My mother's Malaysian, used to be a Buddhist, and her ethos is to live life to the full and make the most of every single day. That's my house. Oh, nice. And I do often just try and fill my days and my life with as much as I can because you don't know when things are suddenly going to change.
King CD Resus.
Yeah.
Oh. Okay. Yeah. Thank you. Bye.
Pediatric trauma, 8 minutes. Pediatric trauma, 8 minutes.
When a paediatric red phone comes in, certainly you're in a sort of heightened sense of awareness. It is more stressful dealing with young people. Are you going to the peds department? Yeah. You can ask them to come at the same time then, just in case they didn't hear the tannoy. You've got not only a child who maybe doesn't even know what's going on and is very distressed, but also a family who are extremely concerned about their young one. It can be mentally and much more emotionally draining. Hiya, 4-year-old just come off the bike, but it's clearly fractured femur.
4-year-old Alfie has been rushed to King's with a suspected broken thigh bone after falling off his bike into a sandpit. The doctors are concerned Alfie may have ruptured an artery, causing internal bleeding.
Right, Alfie, we're going to put you on the hospital bed now, okay? Good boy.
Yeah.
Alfie, 4 years old, he's fallen into a sandpit. Mum's heard him cry when we got called.
Alfie, can I put these sticky things on your chest?
It's obviously deformity to the right femur, both swollen. He's had 3.2 milligrams of oral.
Somebody who's broken their femur, certainly that needs to be seen in resus. It's a pretty dangerous thing to happen.
Normally fitting well and don't know how he's fallen, non-witness.
It can injure all the things surrounding it, blood vessels and nerves being the most important.
So, Mum, can you just shed any light on how far he fell, or what?
It was about that thick,
Okay.
and he just tumbled over.
All right, okay.
Yeah, and then I just see him laying on his back, and he was just screaming.
The worst case scenario would be that he could have in fact bled to death.
Hey, Alfie. I'm Ling, I'm one of the doctors. Nice to meet you. Can you put your mouth like this, going, ah.
Oh, well done. Chest is rising equally bilaterally and there's good air entry bilaterally as well.
Dear. Who's going to touch your leg, darling?
Let's have a little take a video, Tammy. You're very brave. So children's reactions can vary, really. Some start screaming and shouting and crying and rolling around, which is completely understandable. But others can go just very quiet and withdrawn.
Alfie, is your leg hurting you? Is it hurting lots? Really, really, really lots. I'm just going to put that one back on just for a second, and I'm going to get you some medicine, all right?
It was just riding around the park, riding around the sandpit, and then looked away for 2 seconds because we were teaching my older daughter on her bike without the stabilisers. And then she called at me saying, "Mummy, look at me." So I turned around quickly to look at her, doing really well. And then I looked around again and Alfie was laying on his back. He's very adventurous. Always loves to go out and play, meet new people. Always wants to get his bike and play on it. He gets away with a lot with me. I'm quite very soft. I think because of my upbringing and the things I had to go through, it's made me more protective, I think, than other parents.
Alfie needs an X-ray to confirm whether he's broken his femur.
It was fantastic. It was a really, really good day. And everyone got hungry, so I went up to the top of the road to go and buy a big bucket of chicken. I was gone maybe, I don't know, 5-10 minutes. I came back and I could hear the screaming as I was coming down the hill.
Does it taste okay? What does it taste like? Strawberry. Does it? There we are, well done.
We just couldn't believe how serious the accident was. We didn't expect that at all. We just thought he'd just fallen off his bike like he's done a couple of times before.
You're right.
Oh, I'm in too much pain to get.
42-year-old James has been brought to A&E by his wife Fiona.
Hello.
Hiya.
What's your name?
James.
Hi, I'm Dr. Ahmed. I'm one of the A&E doctors here.
Hiya.
What's happened to you?
Chest pains, I can't breathe at the moment.
How long's that been going on for?
About a week or so.
You've not had any problems coughing up any blood or anything like that?
No, not yet.
Not yet, no.
I have always called James a hypochondriac. Whenever he has problems, yeah, it's always exaggerated. So there are times when I just think nothing of it.
Do you mind if I do a little blood test which tells us about how your breathing's doing?
Not at all.
But this time, I thought to myself, I can see you're in pain, but you don't want to go. So I was asking and asking and asking, and in the end, he gave in.
I've got to do it from your hand.
Oh, God, not there again. Oh, God, that hurts.
It's an important one that tells us about your breathing, you see.
I'm not breathing now. You're making me hyperventilate. Oh, boy, here we go.
Oh, don't worry.
You sure that needle's big enough?
It's not going to go all the way.
I don't want to.
Sharp scratch coming now. Just relax. There we go. That wasn't that bad, was it?
Wasn't that good either.
James used to work in our warehouse as a warehouse operative, and I was upstairs in the offices doing admin. We used to flirt with each other all the time, just have a little bit of banter. I saw the twinkle in his eye every time I passed by. And it was lovely.
I'm just going to lie you down a bit flatter.
Why not bother coming today? Oh,
So, is that sore when you move like that? Just going to have a little feel here. That sore down there?
Yeah. That is
that sore
that's
there?
really, really sore, yeah.
That's
that
very
is really
strange.
sore.
At the time, I had to go round and ask everybody what they wanted for lunch. And when I came to him, it was always, oh, well, I fancy a bit of dark chocolate. So at first I thought nothing of it, but then he said it a couple more times. And then it was, yeah, I want you. And then eventually we got together.
We'll have a little think about what we're going to do, because we haven't got a clear picture exactly about what's going on yet. OK?
Thank you.
It shouldn't be too much longer.
Sorry for wasting your time, Doc.
No, not at all. You're not wasting your time at all, no.
Feels like I am.
No, not at all. You've got a valid reason to be here, definitely.
Thank you. That needle was big, wasn't it? Mm-hmm. Can I have a mushroom now?
Not allowed to eat.
Shh, give me a mushroom. You'll starve you. Bitch.
Alfie's X-ray has confirmed that his thigh bone is broken.
They'll be helping you, aren't they?
Being a doctor, you see unwell people all the time, and it can become a little bit clinical. But when the relative comes in and is shocked and upset and sees how much pain their loved one is going through, it becomes so much more real, and that can get to you.
Yeah, baby. Yeah. I know. Just keep it still, my baby. The doctors are going to make you all better, my darling, okay? I love you.
Because of what happened when I was a little girl to my sister. That's why I'm so protective over my children. I don't like them at my sight. If I don't see them, I start panicking. You just want to keep them safe from anything that's dangerous.
I love you.
I was nearly 2. She was 9 years old. All she was doing was playing outside. She just wandered off out the front for a while. Didn't come back for dinner.
Have you got sleep?
She was murdered by a school caretaker. My mum and dad never got over it. It's something that I don't think any parent could ever get over. They always blame themselves, which was always tough to see.
Hey, honey. He's sleeping at the moment. He's proper drugged up at the moment, so he's gonna sleep. Just feel helpless. Yeah. Yeah. He's just jumped. Alfie, I'm here, baby. I'm here. He's just jumped in his sleep. He's done. Yeah, Alfie, what's wrong? He just jumped in his sleep and he looked a bit confused on where he is.
I was just in complete shock because seeing Alfie in so much pain, and there's nothing I could do. It was hard. It just brings back all the emotions.
I'm okay. Just look after the babies for me.
Because of what happened to her sister, she is super protective. I have to be strong all the time, even though I might be panicking myself, but I can't show Tony that. But that night, when they were gone, I sat there, I had a little cry. Because it was probably the best time to let it all out.
I don't know yet, not sure. But they need to align his leg in a while, which is going to be a bit painful for him.
Hello, we're still waiting for your blood tests. To me, it doesn't sound like this is all happening in your chest. I'm wondering whether it could be your kidney.
Yeah.
It's difficult to tell because there is a bit of blood in your urine, which you shouldn't really have.
No.
So we have to think about that. Hopefully it shouldn't be too much longer.
Okay, because I'm starving.
You're starving.
Thank you. It's got blood in my urine now.
You've got a chest infection with a kidney infection.
I'm doing well. I'm doing really, really well, yeah. Ow, that hurts.
We dated for about 2 years before he then popped the question. I told him that he had to ask me again properly because he wasn't on his one knee. So he got on the one knee and asked me to marry him. And I said, yeah, why not?
Can I take some of your blood?
No.
You were saying your family had some reservations about the wedding.
There's a little bit of the fact that they didn't like Fiona because of colour. What generations have told other generations. You tell someone that this person's bad and this they grow up to believe, that's all you know until you're shown differently. Thanks, darling. Make it come. Thank you. Been together 12 years. Everybody in there is fantastic. They love Fiona. Fiona loves the family. My mum rings constantly. Not to talk to me, but to talk to Fiona. They realised they were wrong. And I was right.
Good boy, baby. Alfie, I'm so proud of you.
Alfie has broken his femur after falling off his bike.
I'm going to buy you the biggest present, anything you want. Lots and lots of them, okay? What one? 10 of them? Yeah. Do you want that car thing that you wanted with the wheels? Yeah. Shall I buy you that one? Yeah, I'll buy that tomorrow for you, yeah?
Alfie has a bit of a speech problem at the moment, so he doesn't know how to get his words out properly.
We'll get that tomorrow. Okay, I'll get Daddy to go buy it for you.
A lot of people have trouble understanding him, so I have to translate what he's just said.
There's no dangerous bleed in Alfie's leg, but he's been given additional painkillers before his leg is carefully manipulated into its correct position to reduce the risk of nerve damage.
We just need to have a look at your leg, okay, because we want to make it better. All right? You hold Mummy's hand.
I've got you squeeze
okay?
my hand as tight as you want to,
and
okay?
I'm just going to hold your leg very, very slightly, okay? And we want to make it better, all right? You're doing so well, Alfie. We're going to move you out of this area very, very soon, okay? Well done, darling.
It's okay. You're a strong boy. You're a strong boy. Alfie, you're so strong.
Well done.
You're such a good boy. You're so brave.
You're so
I'm
brave.
going to tell Daddy how brave you are. You're so brave. Your Mummy's going to buy you a big present for being so brave.
He was obviously in so much pain, but he handled it so well. He handled it a lot better than I ever would. I would be screaming the hospital down if it was me.
Yeah.
You're so brave.
Yeah.
That's a good
And then I'll go straight.
You don't want to give pain to anybody, but you certainly don't want to give it to a child.
Mummy's here, baby. Don't you worry.
Adults, to some extent, can understand why you're doing it, but certainly when there is a concern that they might not be able to use a leg again because of the nerves, you sometimes do just need to put people through that pain.
You're so brave. Rest your leg now. They're going to rest it now. It's going to rest it now.
Sort of, yeah, no pain, no gain sort of situation, unfortunately.
No, it's okay. It's all right, my baby. Relax, okay? Close your eyes. Relax, my baby.
I don't want Alfie to grow up. I want him to stay my little baby forever. But even when he's grown up, he'll still be my boy. And I think we'll always have that close bond together, definitely.
Good boy, Alf.
Look at this. Hiya, hello.
The lady in charge asked to bring you to another waiting area, please. Sure.
James is being moved to wait for his blood test results.
Thank you.
Thank you.
ADU. What the hell is this? This don't look good. There's always that thing in there. Because it's comfy chairs. Sitting there, you can shut the door, no one's going to hear you. You're going to give me bad news.
It's a waiting room.
For what? Death?
We should be going to Brighton together if obviously we both get into the uni. But yeah, hopefully, fingers crossed.
I have mixed feelings about Chris going to university. I will miss him. There are some days when I think I'm not going to manage without him. Don't know what I'd do with myself. So it'd be a very quiet house without him.
His confidence has definitely been knocked since he broke his leg. He's a lot more wary, which is sad to see because he had this beautiful little run. When he used to run, he used to like do this sprint, and then all of a sudden he did this little skip in the middle. It was the most beautiful thing you ever saw, but I'm hoping he'll get it back. I'm hoping that he'll get his confidence back again.